Because the reason why it's like this, okay, so because I see so many patients, right? Okay, they went to 4-5 different MD, they come to see me now. So like, even though like NFL player, Olympic marathoners, right? They went to so many MD medical doctors. They went to physical therapy too. They come see me. So after like 4, 5, 6, 7 times, they feel so much better. But the reason why we record a video, because I want to compare before and after, right? So make sure I have your permission to record a video,
yes,
right?
Yeah, definitely.
Okay. So like, tell me like, what did you try? You went to MD, so like physical therapy. What happened to you?
Massage.
Massage, yeah.
And chiropractic. They have me lay down the machine and then tie my lower back and my chest. Try to pull it up.
The decompression table. Oh, like
decompression table.
Okay, decompression. How much you? These are expensive. Decompression table.
It was covered by insurance.
Really?
Yeah.
Okay.
So it's pretty good.
Oh wow. Okay.
And it wasn't a cure; it's just a relief.
Yeah.
It keeps coming back.
Yeah, you keep coming back for sure. So usually, even for decompression table, because I work for decompression table, I work for so many clinics already. So usually decompression table more expensive. Okay. Usually at the same time, like how many times do you go there? Like 1 time per week, 2 times per week, and then like how like couple months.
Twice a month.
Twice a month? Oh, that's not a lot though. Okay.
Yeah.
So like for how long? Like 2 months, 3 months, 4 months?
For 6 months.
Oh, for 6 months? Oh, twice. Okay. I see. So and then.
And.
Did they take X-ray for you? No, right?
Yeah, they did.
Oh, perfect. Okay, good.
X-ray, MRI, ultrasound.
Like in Houston or in New York?
In New York and also in Houston.
Oh, really?
Yeah, because when I came here, the doctor they say it's been this long.
Okay.
They prefer to have a new X-ray.
I see. So like you mentioned like your doctor is MD medical doctor, right? Did they take X-ray for you, right? Did they explain to you? No, usually they don't, right? Yeah, they only only give you a CD. Maybe ask you to go and read it. Like you're not gonna read it for sure.
Yeah, I don't understand.
Yeah, exactly. So you know, okay, because I read so many from MD medical doctor, like Memorial Hermann Hospital, all kind of hospital. Usually they give you 10-page report. You have no idea what's going on. That's why the patient asked me bring the report to explain to them. Okay, so because like even though if all this work still confusing, and then so like what did they do? Like you went to MD medical doctor, right? They give you pain pills, steroid injection, anything?
There were 2 times I had to do the chromosome shots.
Oh wow, steroid injection. Yeah. Okay, I see. You feel better? Like?
Not really.
Not
really.
So where they take the shot? Low back, like mid back?
My pain it's more these area.
Okay, low back. You travel all the way down?
Yeah.
One leg or both leg? One leg, right?
One leg.
Okay.
Yeah.
So and then like when you say travel all the way down, is it past your knee level? You like do you feel numb on your feet, hand?
Yeah, on my toe.
Big toe, little toe.
Well, I just feel that it's.
You feel numb?
Yeah.
Oh wow, it's so weird.
When they do the hitting thing, this leg doesn't.
Oh wow.
Doesn't move.
Okay, I see. And then so like even steroid injection, and then it like nothing help you.
Well, the pain comes back.
The pain comes back. I see.
Yeah.
Okay, and then so
not that much on my shoulder, cause right here. Where I feel that.
And then do you still do the mechanic? Do you still?
I couldn't.
Oh, you couldn't? Too much pain?
Yeah.
Oh.
Because since 2018 I stopped. I was transferred to a parts department.
Oh wow.
Yeah, because I can't.
Can't
bending down is okay, but coming back up, that's where the pain starts.
I see. So like you went to like even chiropractic too, right? Usually like so many patients they tell me chiropractic they only do massage, right? Yeah. I mean like even though you went to decompression table, so what else do they do? Do they do the hand adjustment like both like neck, low back, both?
So before I go to the decompression table,
yeah,
the doctor would do the
adjustment.
Cracking my bone.
Did they take X-ray for you?
When I first went, yes. Yeah.
And then like after maybe like couple months later, did they take any X-rays? Any improvement? Like did they show you?
No, only the beginning.
Only the beginning?
Yeah.
What? they should take another usually after a couple months later. Because even I tell Amanda, right? Amanda, even her husband come here now. So after my 16 weeks, after like 3 months, 4 months later, I'm gonna take another X-ray. So you go see some improvement. Yeah. So like without if you don't see any improvement, then yeah, you're not gonna come. Yeah.
If this pain can go away, I'll be delighted.
I see. So like your pain lasts for like more than like 4-5 years now, right? So since like 18, like turn to 18, yeah, it's been 4-5 years now.
Yeah.
So I mean, usually I just tell the patient, okay, so like I hope you understand, you cannot undo like 4-5 years damage in like couple visits, right? It's common sense. Yeah.
I understand.
Okay. At the same time, I'm gonna ask you, okay, from 0 to 10, 10's worst pain, what's your level right now? 4, 5, 5, 6?
It's constantly like 4 or 5.
4, 5,
Yeah.
and then so let me ask you, okay, like no casting, no surgery, right? Like nothing, like you fell down, you hit something, okay, make sure nothing, right?
No.
And then like so can you like so and then let me see here, like so in here, like mid back, low back.
Lower back.
Okay,
They
lower back.
say I have
This
problem with S4, 5, and 6.
Yeah, I'm gonna take an X-ray for you so you know what happened. And then how your shoulder?
Shoulder, they just say that the X-ray looks normal, but right here, I constantly feel pain.
Constantly feel pain. 4, 5, 5, 6.
Yeah.
Wow, all day, right? All day, every day. You cannot.
4 and 5, it's considered normal to me now.
Oh my god.
Yeah.
Oh
There
wow.
are times I couldn't sleep.
Okay,
The
okay.
pain is severe. I don't know what happened. It just comes and goes.
Oh, so it's coming, so, oh, I see. Chen, good, perfect. So, yeah, one example. Like your hips off, okay? Okay, yeah, take deep breath in, inhale, all the way out, exhale, okay? Okay, one more time, inhale, all the way out, exhale. Yeah, okay, one more time, inhale, all the way out, exhale. Yeah, well, like so tight, okay? So, this time inhale, hold it. Yeah, so, okay, good. Okay, face me side or side, yeah. So, just let you know, today first session, I barely pull your bone, okay? So, but you could get better each time, so it's tight. So, I'm gonna see how bad is it. So, your body will be closer to the table. Good. Yeah, it's very tight, oh my god. It's so tight. You can see the bone spur very sharp already. So, okay, good. Yeah, the other side. At least like your lower back is moving. I just tell you, this is first session, right? Your bone and joints not clean up. It's so tight, okay? But you could get better. Yeah. So your body will be closer to the table, okay? So lift. Okay. Okay. Yes. Yeah. Okay. On your back. Yeah. Scoot upside a little bit. Chen, a little bit more. So, like you and I saw your X-ray, right? Your neck so straight, okay? The green color is normal. Should be your neck, even lower back should be 42 degrees. Your neck so straight. I try to get the curve back. You're a mechanic, right? Same as like all this shock absorption suspension. So if your neck so straight, there's no suspension, right? So there's no shock absorption. That's why all the patients like neck pain, upper back, shoulder pain, okay? So good. Okay, yeah, make sure you relax. So drop shoulder, okay? So let's see. That's good. Yeah, your neck's tight. But at least I can move one bone, so it's better. So I'm trying the other side, so make sure you relax. Drop shoulder, okay? So up good. Nice. Yeah, the neck's tight. But the other side, you move better than the left side. So some patients it won't move at all. Okay, even 40 years old, I saw so many patients. There's 40, even 30 years old. Sometimes they don't move. But okay, so Chen, okay, so just let you know, all the patients just like you mid back, low back pain, right? So you have to partial screw partial. Okay, don't slouch it. But at the same time, when you in the morning, when you get up from the bed, because you mentioned low back pain, okay? So stop doing the seat motion, right? You're not going to keep doing like this. You're not trying to get the perfect abs, right? You don't want to keep doing seat motion. The correct way, just turn the body sideways. You have to good posture, okay? So turn the body sideways, and then keep turning sideways. Like in the morning, using elbow and hand push yourself up is easier. So sit up for me, get up for me. Yeah, sit for me. Yeah, using elbow hand, sit for me, go. So, because using elbow hand, you got more support, right? You got more leverage. Instead of like all the patients just doing the seat motion. You mentioned low back pain already, right? You can see your like L5, S1 decrease so much already, especially low back this area. All the patients come here like this, right? You mentioned about like, okay, right leg is still tingle numbness. Because this is sciatica, right? I think I told you already.
Yeah.
This is sciatic nerve travel all the way down. This is largest nerve in the body, okay? So, yeah, this is like L4 and L5 nerve travel all the way down. So like it combine together. So it's largest nerve. It go behind the back, travel past the knee level. So make sure, okay? So right now, okay? So what I do right now, okay? So, okay, I'm gonna explain to you. So I think I told you before. As we age, as we get older, the disorder decrease, right? It's common sense. It makes more like sciatica, right? So this is like, because when this compress, it pins the nerve. Right now, it pins your nerve so much, okay? So what my solution right now? I try to decompress your spine, decompress. Make more space for this nerve, okay? So Chen, I try to decompress your spine. So slide all the way back, okay? Be careful, this might be here. But at the same time, okay, yeah, this good, okay, good, perfect, okay. So you hand do it this, yeah. Make sure you grab it tight. So, because I try to decompress your spine, I try to carry you on my back, okay? On my back. Okay, let's see if I can. Just make sure you relax upper back, okay? So give me some space and then relax upper back. Okay, yeah, make sure you relax, okay? Okay, one more time. Good. Yeah, okay, good, relax. Yeah, that's like, yeah. So, but like today's first session, like, yeah, because of mid back, yeah, so tight. And then pretty much a lot of tension, okay? I try to decompress, I barely move one bone. So when now, like you mentioned about shoulder, right? Your right shoulder, right hip, okay? So, okay, face up for me. Okay, so, okay, I'm gonna let you know, okay? So, okay, in here, this is focus over here, right? I'm gonna explain to you. Okay, because I'm gonna ask all patient, okay? So, okay, usually you mentioned about like your pain level when at 4-5, right? Okay, the pain level should be like this, okay? So from 0 to 10, the pain level should be around 4 to 5. So I don't want like you feel like this is shockwave, right? It go make it sound like this. Okay, I'm not having, but yeah, you hear big sound, right? The reason why it's big, like even the kidney stone they can big it, right? So only work for like if you have a muscle tendon ligament is damaged. Only work for damaged area. So if your bone is healthy, you're not gonna feel anything, right? So like you don't feel anything here, right? Like do you have a pain? No, right? Okay, I'm gonna let you try it on, okay? So I'm gonna put it on. Okay. So it's easy. Like how your hand, no pain, right? Okay, I'm gonna let you try on. But you feel it, right? You feel a little bit sharp, but no pain, right?
Okay.
Yeah, because this area is not damaged. Okay, so I just let you know, okay, because for healthy tissue, muscle tendon, you're not going to feel anything. If I put you on, like, that's why I need to constantly keep asking you, like, oh, what happened here?
It's been like this.
Birthmark?
Yeah.
Oh, okay. So let me know. So when I like the leg pain right now? No, right?
No pain.
Okay. I'm gonna turn this one. So when I your shoulder pain? Here?
Right here is a little bit.
But when I'm where do you feel the pain? In here, in that area, where is it?
Where you put it last, by the shoulder area.
Here?
Yeah.
What's the pain level? 4, 5, 5, 6?
2, 3 maybe.
2, 3, oh.
Okay, now it's increasing.
So I try to find the damaged area, right? So let me know.
Okay, here I feel pain.
Here.
Yeah.
So, like, here you feel more pain or this one you feel more pain? here.
Yeah, yeah,
It's more pain, right?
yeah.
Pain level 4, 5, 5, 6,
I'll say 6.
6. Like, let me know if you want me to decrease the power, okay?
Okay,
So it's okay, right?
this is okay.
Okay.
Not so much here.
That's what okay, how about here? No?
Here, yes. Here, yes.
Here's
Yeah.
good. You want decrease power? It's okay.
This is okay.
It's okay. 4, 5,
Probably 6.
6. Okay, good.
Over here is a little bit more.
Little bit more, okay, good. So if more pain is like the area is more damaged, okay? So I try to find the most damaged area. So let me know, okay? So if I change angle a little bit, is it more pain, less pain?
Right now is less pain.
Less pain. So in here is more.
Yes.
Good. Okay. Yeah, focus on this part first. Okay, Chen, I'll try different area, okay? So let me know.
Okay.
So if you pain here, no, right? No? Not much?
Right here, yes.
So you feel more pain here or here more pain?
Right here is more pain.
More pain? Oh!
Yeah.
Okay, good.
Here even more.
You want to decrease one more?
Yes.
Okay, I'll decrease one power, okay?
Okay.
So,
Okay.
so let me know if you want me to decrease one more power, okay? So it's okay?
This is
It's
fine.
good? Okay,
This
good.
is fine. I feel pain, but not so much.
Not so much, okay, good. So, okay, I'll try different area, okay? Let me know. So, like, same pain, same, more or less? All this.
Oh, this is more pain.
More pain?
Yeah.
You will decrease one more power?
Yeah, decrease it more.
Okay.
Maybe one more.
One more? Or it's too much? Okay.
Yeah.
So, how about one more? Do you want to decrease one more? It's okay now?
No, it's okay.
Okay, good. Yeah, your case is really
So this area is actually, I feel the most pain now.
most pain? Okay, good.
Yeah, when you do the,
Mhm.
you do it with the shockwave.
Yeah.
Oh, this is more pain.
It's more painful?
Yeah, right here. Next time I come, I should wear a tank top, right?
Yeah, I think top is easier.
Okay.
Yeah, I think top is easier. So, like, okay, by the way, so I put almost 3,000, right? 3,000 net, low back, 3,000 like 600. Okay, so just let you know. Okay, like any improvement, like just tell me, like you feel a little bit looser or something. So like after this is your first session, you go get better each time. So net, low back, anything a little bit looser. Yeah, because like just let you know, maybe like tonight, tomorrow you go feel like a little bit better, right? But the pain may come back like 2-3 days later because your case is chronic pain, right? So your chronic travel all the way down. So 1 session, 2 sessions is not going to like make it better. So I mean, like any question for me, question concern. So so next time you come here, I'll do all this X-ray for you, right?